extramedullary disease is certainly an unmet need in multiple myeloma, and the incidence is increasing at later phases of the disease, regardless of the success of the treatment, can be observed after cellular therapy such as CAR T therapy or allogeneic stem cells transplantation. And in this Congress, we have presented our ICARIA study subgroup analysis, which aims to compare the addition of isatuximab to the backbone of POMDEX. And there were 34 patients within the 300 patient profile of the ICARIA study, and 24 of those patients were in the ICARIA POMDEX arm versus 10 patients in the control arm. And we were able to observe response rate, which is more than equal and more than VGPR in the experimental arm, which is 24%, double the control arm. And the median PFS was 4.5 months in the experimental arm versus 1.5 months in the control arm. So patients in advanced stages with the median 3 lines of therapy, this is a good achievement. And during the ASH Congress, there were similar studies without a monoclonal antibody. There were 2 studies, for instance, one from the Mayo Clinic focusing on extramedullary disease on 11 patients using ixazomib plus POMDEX, but the median PFS was only around the range of 4 months. And in the Horizon data, which is another important study, earlier Paul Richardson had presented the melphalan dex data, which has a median PFS of around 2.9 months, and the data was represented during ASH. And during an oral presentation, Dr. Enrico Osio presented melphalan combinations, either with bortezomib or with daratumumab. And during the Q&A session, he mentioned that there were 4 out of 4 responses with the dara-melphalan combination. So adding a monoclonal antibody to one of the backbones of relapse treatment seems to favor. And as a final point, during this ASH meeting, there were CAR T studies presented again in the context of extramedullary disease. And one was from the CARTITUDE study. And Nopuraja presented data from the extramedullary disease comparing with the non-EMD. And there are CR rates around 20%, which is higher than, which is unfortunately less than the non-EMD patients, about half. But the PFS is 7.9 months, which is a good duration. And the Chinese CAR T study, in a similar fashion, obtained similar 8 months of PFS, which is a signal for future that bridging therapy with CAR T cells can be integrated in the treatment of extramedullary disease.